Good morning, my dear students, second year ISP, your medical English teacher as always in another course. So, last time we have dealt with the essay and how to write it and its types, and we have also seen the different types of letters or application letters. Today we will see another technique or another aspect that can help you during your work or during your study. Today we will go and discover what is a nurse care plan. So, to start, we have first to define nurse care plan or NCP. Writing the birth nursing care plan requires a step-by-step approach to correctly complete the parts needed for a care plan. In this lesson, we have the ultimate database and list of nursing care plans and examples, nursing diagnosis samples for our student nurse and professional nurse. Of course, here we are illustrating or giving example to both either professional nurse or student nurse to use all for free. Components, example, objectives, and purpose of a care plan are included together with an elaborate guide on how to write an awesome or a very excellent nursing care plan or a template for your unit. So, what is a nursing care plan? A nursing care plan or NCP is a formal process that includes correctly identifying existing needs as well as recognizing potential needs or risks. Care plans also provide a means of communication among nurses, their patients, and other healthcare providers to achieve healthcare outcomes. Without the nursing care planning process, quality and consistency in patient's care would be lost. So, a nursing care plan is a document that serves other team members or either patients, so that help nurses to work together easily. Nursing care plans begins when the client is admitted to the agency and is continuously updated throughout the response to clients' change in condition and evaluation of goal achievement. Planning and delivering individualized or patient-centered care is the basis for excellence in nurse practices. So, we will move and talk about types of nursing of care plans. Care plans can be either into types or two forms. It can be a formal one or informal one. Informal nursing care plan is a strategy of action that exists only in the nurse's mind, while the formal nursing care plan is written or computerized guide that organizes information about the client's care. So the difference between the two types, informal and formal, is that the informal exists only in our minds or in the nurse's mind, while the second type, which is the formal type, should be written or copied down. Formal care plans are further subdivided into standardized care plan or individualized care plan. Standardized plans specify the nursing care for groups of clients with everyday needs, while individualized care plans are tailored to meet the unique needs of a specific client or needs that are not addressed by the standardized care plan. So the difference here between the two is that the individualized is only for one patient, while the second type is for a group of patients. For example, you are working in a domain, in a surgery part of the hospital. So, while doing a standardized care plan for all patients, rather than doing the individualized care plan for one single patient. The objectives behind the writing care plan. The following are the goals and objectives of writing a nursing care plan. First, promote evidence-based nursing care and to render pleasant and familiar conditions in hospitals or health centers. That's what we have mentioned before. Support holistic care, which involves the whole person including physical or psychological, social, and spiritual in relation to management and prevention of this disease, which means that care plan includes all the members or the workers in the hospital. establish programs such as care pathways and care bundles. Care pathways involve a team effort in order to come to a consensus with regards to standards of care and expected outcomes, while care bundles are related to best practice with regards to care given for a specific disease. Identify and distinguish goals and expected outcome. Review communication and documentation of the care plan. Measure nursing care. So these are all the objectives behind writing a nursing or a good nursing care plan. Purposes of a nursing care plan. The following are the purpose and importance of writing a nursing care plan. First, it defines the nurse role. Second, provides direction for individualized care of the client. It allows us to give more details about a specific nurse. Third, continuity of care, which means that a nurse, while reading a care plan, he keeps or he continues to take care of the nurse. So, while he is knowing what happened to the nurse, he will try to do his best to stay with him. Serves as a guide. For reimbursement, the medical record is used by the insurance companies to determine what they will pay in relation to the hospital care received by the client. Defines client goals, so it shows us the client goals or the client's aims behind the therapy. Documentation. It should accurately outline which observations to make, what nursing actions to carry out, and what instruction the client or family members require. If nursing care is not documented correctly in the care plan, there is no evidence the care was provided or either exposed. Serves as a guide for assigning a specific staff to a specific client. There are instances when a client's care needs to be assigned to a staff with a particular and precise skill. So, the nursing care plan shows us or determines the nature of the nurse needed in the job. Moving now to the components of a nurse care plan. A nursing care plan usually includes nursing diagnosis, client problems and expected outcomes, and nursing interventions and rationales. These components are elaborated below, and we will see them. First, client health assessment, medical results, and diagnostic reports. This is the first measure in order to be able to design a care plan. In particular, client assessment is related to the following areas and abilities, either physical, emotional, sexual, psychological, or cultural, spiritual, transpersonal, cognitive, functional, age-related, economic, and environmental. Information in this area can be subjective and objective, so a nurse care plan contains all this information about the nurse. 2. Expected client outcomes are outlined. This may be long and short term. Nursing intervention are documented also in the care plan. So the role of the nurse or the work of the nurse is also documented in the NCP. Rationale for intervention in order to be evidence-based care, and later on we will see how to do a rationale. Finally, evaluation. This documents the outcome of nursing interventions. So, we will see some care plan formats. Nursing care plan formats are usually categorized or organized into 4 columns. Nursing diagnosis, desired outcome and goals, nursing intervention and evaluation, or either it can contain 3 columns. So we have many types. Some agencies use a 3-column plan wherein goals and evaluation are in the same column. Other agencies have a 5-column plan that includes a column for assessment cues. So here, like we see, we have a nursing care plan with 3 columns. We have the nursing diagnosis, we have the outcomes and evaluation, which means the view of the nurse on the state of the patient, and we have the interventions or the role of the nurse. We have also the second type, which is the 4-column type, which contains the nursing diagnosis besides the goals and outcomes behind the therapy or the treatment. We have also the interventions, as you see here in example, the role of the nurse, assess the rate, rhythm and depth of respiration, taking, for example, the heart beats. Then you have evaluation. After 8 hours of nursing intervention, the patient was able to maintain patient's airway with breath. So here, the evaluation tells us a little bit about the result. So, there is another type, or there is a difference between a professional care plan and a student care plan. In your case, as you are still studying, you are obliged to see what is a student care plans. Student care plans are more lengthy and detailed than care plans used by working nurses because they are learning activity for the students. Care plans by the student nurse are usually required to be handwritten rather than taken by heart and mind, and have an additional column for rational or scientific explanation, and that may help you to remember later on why this happened and why other things happen. After the nursing intervention column, rationals are scientific principles that explains the reason for selecting a particular nurse intervention. For example, while you have a patient who is suffering from blood pressure, you are obliged to see his or her heart beats. So here is rational to see the real reason or the real scientific reason behind your intervention. And we see here the example with 1, 2, 3, 4, 5, 6 columns, which contains assessment, diagnosis, outcomes, interventions, rational in your case as a student, and evaluation. So, writing a nursing care plan. How do you write a nursing care plan NCP? You have just to follow the steps. Step 1, data collection or assessment. So, our first step is the process of collecting our data. The first step in writing a nursing care plan is to create a client database using assessment techniques and data collection methods, physical assessment, health history, interview, medical records review, and diagnostic studies. So here are the methods used to collect data, either interviews or medical records or health history. A client database includes all the health information gathered. In this step, the nurse can identify the related or risk factors and defining characteristics that can be used to formulate a nursing diagnosis. Some agencies or nursing schools have their own assessment formats you can see. So, there are many formats of nursing care plans. The second step is the data analysis and organization. Now that you have information about the clients, after all, and you gather the data, you have to analyze them and organize the data to formulate your nursing diagnosis, priorities, and desired outcomes. The third step is formulating your nursing diagnosis. Nursing diagnoses are a uniform or a way of identifying, focusing on, and dealing with the specific client needs and responses to actual and high-risk problems, actual or potential health problems that can be prevented or resolved by independent nursing intervention, are termed nursing diagnosis. So after analyzing your data, you will be able to formulate your diagnosis. The fourth step is setting priorities. Setting priorities is the process of establishing a preferential sequence for address nursing diagnosis and interventions. In this step, the nurse and the client begin planning which nursing diagnosis requires attention first. So here, after getting a comprehensive discussion with the patient, you will be able to set the priorities of your patients. Diagnosis can be ranked and grouped as to having a high, medium, or low priority. Life-threatening problems should be given high priority. Clients' health, values, and beliefs. Clients' own priorities, resources available, and urgency are some of the factors the nurse must consider when assigning priorities. So all those elements, you have to take care about them and classify them from the high risk to the low risk level. Of course, by involving the client in the process to enhance cooperation and communication with your patient. So here we see the pyramid of needs or priorities. So as you see here, we start by the psychological side: breathing, food, water, sleep, home stacks, and exertion. Then we move into the safety, which means the security of the body, of resources, of morality. Then we will go up and talk about the love or belonging, which means friendships, family, sexual, and here we are classifying them from down to up, from the low important to the most important. Esteem, self-esteem, confidence, achievements, and the respect of others. Self-actualization, which means morality, creativity, spontaneity, problem solving, or either other elements. So the fifth step, which is establishing client goals and desired outcomes. After assigning priorities for your nursing diagnosis, the nurse and the client set goals for each determined priority. So as you determine some priorities, you are also obliged to set some goals and outcomes. Goals or desired outcomes describe what the nurse hopes to achieve by implementing the nursing interventions and are derived from the client's nursing diagnosis. So here we have some examples of goals and desired outcomes. Patients will display vital signs with acceptable limits. And here we have absent or either absent or controlled and non-symptoms. So here are the examples of goals and desired outcomes, which means the response you get from the patient story or the goals admitted behind every therapy. We have two types of goals. We have short-term and long-term goals. Goals and expected outcomes must be measurable and client-centric. Goals are constructed by focusing on problem prevention, resolution, and rehabilitation. Goals can be short-term or long-term. Starting by, we will see a short-term goal. It is a statement distinguishing a shift in a behavior that can be completed immediately, usually within a few hours or days. That means a short-term goal is something that you are expecting to happen in the few coming hours or days or in a short time, while long-term goal is the contract, is the goals or the needs or the aims that you are expecting to happen after a long period of time. We will see also the components of goals and desired outcomes. Goals or desired outcome statement usually have the four components. As we have studied before, a subject and a verb, condition or modifiers, and finally a criterion of desired performance. So here we have an example. A client will ambulate unassisted with crutches by discharge. So here we have the subject, which is obviously the client. We have also the verb, which is ambulate. Condition or modifier is unassisted with crutch. Sometimes a person fails and broke his leg. So after the period of treatment, he would be able to walk unassisted with the crutch. And we finally have the criterion by discharge, which means by agreement of the therapist. When writing goals and desired outcomes, the nurse should follow these tips. So to have a very good desired outcomes or goals, you have to follow the tips. Write goals and outcomes in terms of client responses and not as activities of the nurse. Begin each goal with client will. So here you have to avoid being subjective and try a little bit being objective and talk in place of the client. 2. Avoid writing goals on what the nurse hopes to accomplish. and focus on what the client will do. So here you give the more importance to the client needs and the client expectations. Use observable, measurable terms for outcomes. Avoid using vague words that requires interpretation or judgment of the observer. So you are obliged to use simple and easy words to make the process easy for the therapist or the doctor to read. Desired outcomes should be realistic for the client resources, capabilities, limitation, and the designated time span of care. Ensure that goals are compatible with the therapist of other professionals. So you have to write the goals working with the therapist or the professional compatibility. Ensure that each goal is derived from only one nursing diagnosis. Keeping it this way facilitates evaluation of care by ensuring that planned nursing interventions are clearly related to the diagnosis set. So, here you are obliged also to write the goals according to one diagnosis, not too vague, to not make the process harder later on for the doctors. Lastly, make sure that the client considers the goals important and values them to ensure cooperation. So by setting goals, the patient will respond to the therapy easily and he will get healthy again soon. Step 6. Selecting nursing interventions. Nursing interventions are activities or actions that a nurse performs to achieve client goals. Interventions should focus on eliminating or reducing the etiology of the nursing diagnosis. As for risk nursing diagnosis, interventions should focus on reducing the client risk factors. In this step, nursing interventions are identified and written during the planning step of the nursing process. However, they are actually performed during the implementation step. Moving on now to the types of nursing intervention. Nursing interventions can be independent or dependent or collaborative. So, starting by independent nursing interventions. They are some activities that nurses are licensed to initiate based on their sound judgment and skills, include ongoing assessment, emotional support, providing comfort, teaching physical care, and making referrals to other health care professionals. The second type is the dependent nursing intervention. Are activities carried out under the physician orders or supervision, includes orders to direct the nurse to provide medication, intravenous therapy, and diagnostic tests, treatment, diets, and activity or rest. So the difference here is in the independent nursing intervention, you are free to use your skills or either your abilities to communicate or to contact your patients. While in the second type, the dependent nursing intervention, you are guided by the therapist or by the doctor, and they are generally the rules or the treatments ordered by a doctor. The third type is the collaborative interventions, which are actions that nurse carries out in collaboration with other health team members, such as physicians, social workers, dietitians, and therapists. These actions are developed in consultation with other health care professionals to gain their professional viewpoint. So, in collaborative interventions, here when you are working together with other team members and other doctors at the same time. Nursing intervention should be safe and appropriate for the client's age, health, and condition, achievable with the resource and time available, in line with the client's values, culture, and beliefs, in line with other therapists, based on nursing knowledge and experience or knowledge from relevant science. So, a good nursing intervention should meet those criteria. When writing nursing intervention, you have also to follow this tip. Write the date and sign the plan. The date the plan is written is essential for evaluation. The second, Nursing intervention should be specific and clearly stated and not too vague. Third, use only abbreviation accepted by the institution and do not exaggerate too much and using long sentences or difficult words. Step 7. Providing rationale. And here in your case, as we have mentioned before, for student nurses must learn how to make rationale. Also known as a scientific explanation are the underlying reasons for which the nursing intervention was chosen for the NCP. So the rationale is the scientific explication, or the scientific reason behind your interventions. Step 8. The evaluation part. Evaluation is planned, ongoing, purposeful activity in which the client's progress toward the achievement of goals or desired outcomes and the effectiveness of the nursing care plan. So in this step, you are obliged to evaluate either your nursing care plan is effective or no by meeting the goals and outcomes from the patient or no. And finally, the last step is putting it on a paper. So before putting it on a paper, you have to evaluate it. The client's NCP is documented according to hospital policy and becomes part of the client's permanent medical record, which may be reviewed by the incoming nurse. Different nursing programs have different care plans, formats. Most are designed so that the students systematically proceed through the interrelated steps of the nursing process. Nursing care plan list. In this section, we will list down the sample nursing care plans or NCP types. We have basic nursing and general care plans. We have also surgery and preoperative care plans. We have maternal and newborn care plans. We have pediatric nursing care plans for little babies or little children. Cardiac care plans, as you see here, is related to cardiology or heart problems. Endocrine and metabolic care plans, which has relation with the internal body or internal tools of our body. Urinary is related with the urinary system or with the urines. Hematologic and lymphatic is all what is related about blood and lymph. Infectious disease, as you know, diseases that can be transmitted. Integumentary and mental health and psychiatric diseases. Neurological and ophthalmic, and finally the respiratory systems. So, dear students, here we have arrived to the end of our lesson, and which was about how to make a good nursing care plan or an NCP. So I took the examples from a different country care plans. If you want to see our documentation or our nursing care plan, you are be able, inshallah, later on to work with this. Acts and examen. Nom, prénom et qualité de protection. And quotation. Service and date. As we have mentioned before, this is an example of what we call in French fiche navette de patient. So you will find all what we have talked before in this paper, and obviously the majority of you see it or see this in the hospital during your work. So we have arrived to the end of our lesson. Dear students, hope that you enjoyed today. Keep yourself safe till we meet next time.